Nigeria bears a huge burden of sickle cell anemia, as about 130,000 children are born annually with sickle cell, with some dying before the age of 5. According to the Ministry of Health, over 40 million Nigerians live with this disease.
Mortalities arising from complications of sickle cell disease occur mostly in children under 5, adolescents and pregnant women. It is also estimated that over 40 million Nigerians have the sickle cell trait.
Both the sufferers of sickle cell anemia and their caregivers experience severe difficulties managing the disorder.
My first crisis was at age 10. I had a major, and it took me, I was rushed into the hospital on the 18th of March and was out on the 6th of August. My parents were surprised. I lost a sister. Our firstborn was also sickler, and so we lost her to sickle cell. And when I had mine at age 10, it was I was almost crippled.
It's been a long day for us. Our son was presented with what appeared to be malaria. And we were in South Africa. We said, treat him for malaria. And then it snowballed into so many other complications. It was bedfast for about 18 months.
Apart from the pains associated with the disease, sufferers say the disorder also affects other aspects of their lives.
The stigmatization has been there. It still is there. It has affected my relationships. I go into relationships. I know the right thing to do is to tell the guy that, look, this is my condition. So if you're in for the long haul, this is what it is. But because of that fear, I'm withdrawn. I hold back because I don't want to lose the guy, you know. But to God be the glory. I mean, when the right guy comes, we would walk down the aisle.
Although stem cell transplant is currently one way of treating this disorder, experts say early diagnosis can be helpful.
Sickle cell disease is a chronic, lifelong disease, and the earlier you make the diagnosis, the better. And that's why newborn screening or early infancy screening is so vitally important.
Sickle cell anemia is an inherited red blood cell disorder. Those who suffer this disorder are said to have abnormal hemoglobin in their red blood cells.